When you look at men and women, you obviously notice physical differences between them. One of the things that distinguishes them from each other is where they hold fat. Women have more of what's called subcutaneous fat, the fat layer underneath the skin. Also, they have more fat on the hips, buttocks, and thighs, while men actually have more visceral fat that is stored within the abdominal cavity and is wrapped around internal organs. So, what determines where men hold the fat? A low level of estrogen. The thing is, visceral fat is way more dangerous because it puts you at risk for various diseases, such as diabetes, insulin resistance, heart disease, and high blood pressure. That means women have fewer risk factors for getting all these conditions because of a higher amount of estrogen, but only until they reach menopause though. Then the risk factor for getting more visceral fat becomes equal to men. But why is that? The answer is simple, because of the drop in estrogen levels. When a woman hits menopause, their estrogen lowers, which leads to building up more visceral fat. Now, what you also need to know is that your fat tissue, also known as adipose tissue, is glandular. It produces hormones, provides storage for fuel, and has many other functions. For example, when you get insulin resistance, you basically get it in different tissues, including muscles, liver, pancreas, and heart. The thing is, insulin resistance impairs the function of those fat cells, causing them to no longer accept fat. That means the fat no longer goes into fat tissue. It goes in, around, and in between your organs. So if you look at the full picture, here's what we have. We have insulin resistance, which increases insulin and is causing more fat to be stored in and around your organs. All these processes cause further resistance to insulin, creating a dangerous cycle. Okay, we know how frustrating it is to get in this kind of situation and not know what to do, but there's a solution to it. The most effective way is to go on a low-carb diet. Why? Because such a diet helps normalize your insulin levels and puts your body into fat-burning mode. Basically, you can't resolve insulin resistance problems if you try to lose weight without lowering your carbs. That's why we recommend going on the keto diet or trying intermittent fasting. Both eating patterns will help you not only effectively improve your overall health, but more importantly, normalize your insulin. Keep in mind that insulin is the main hormone that determines if you're going to burn fat or not. Just don't get obsessed with only losing weight. Always pay attention to how one or another eating method will benefit your overall well-being. Hey, before you go, check out the video where we give you a list of foods that don't cause an insulin spike. Also, check out our ultimate guide on the keto diet, where we put all the videos covering this diet's know-how.